Okay, so get this. Imagine like a world where um, access to cannabis
Hmm.
could actually influence what medications doctors prescribe for mental health conditions.
Interesting.
And that's exactly what we're going to be diving into today.
Yeah.
A study that was published in JAMA Network Open.
Yeah, this study really explores that relationship
It explores that relationship.
between cannabis laws
Yeah.
and the use of prescription medications for mental health disorders.
Yeah, really interesting stuff. So we're talking about things like anxiety medication.
Right. Antidepressants, things like that.
Yeah, we're talking about a massive study here. Over 10 million commercially insured patients.
It's a huge data pool.
Huge data pool.
Yeah, and it's really relevant findings for understanding these real-world trends. And what I think is so fascinating about this is this study focuses on a demographic we don't often see in cannabis research.
Oh, really?
Yeah, commercially insured adults aged 18 to 64.
Oh.
So we're really getting a glimpse into how cannabis laws could be impacting folks in their 50s and 60s, an age group that often relies pretty heavily on prescription medications.
Yeah, so we're getting a good look at that kind of older age demographic.
Absolutely.
With this study.
Yeah, and this is where it gets really interesting,
Yeah.
especially for our listeners who are in that age group.
Right.
The study found that both medical and recreational cannabis laws were linked to a significant drop in the use of benzodiazepines.
Okay, now for people who might not know, I mean, we know,
Yeah.
but for our listeners, what are benzodiazepines?
So you might know them as like anxiety meds,
Okay.
like Xanax,
Oh, okay.
Valium.
Valium. Okay, so anti-anxiety medications.
Yeah, they're also commonly prescribed for sleep issues.
Okay.
And these can be pretty addictive.
I was going to say, those can be pretty addictive, can't they?
Yes, they are highly addictive.
Mm.
They're right up there with opiates in terms of addiction potential. Oh, wow. That's really concerning, especially since you said they're commonly prescribed to older adults.
Yeah, and the numbers are pretty startling.
Oh, wow.
We're talking 8% of adults over 65 use benzodiazepines, and that number jumps to a staggering 33% for those in long-term care facilities.
That's a huge percentage of the population.
It is.
So, I mean, finding an alternative to these medications, especially one that carries less risk of addiction, I mean, that can have a massive impact, right?
Exactly. And the study's findings suggest a potential shift in how people, especially older adults, are managing their anxiety and sleep problems.
Okay.
They found a 12.4% reduction in benzodiazepine use associated with medical cannabis laws and a 15.2% reduction with recreational laws.
Wow.
So that kind of reduction in benzodiazepine use, it not only means fewer people struggling with addiction, but it could also mean fewer falls, fewer cognitive issues, and overall better health outcomes.
And I think we also have to mention the financial side of this.
If fewer people are experiencing the harmful side effects of these medications, it could lead to some major cost savings in healthcare.
Yeah, you're right. Fewer ER visits, fewer hospitalizations, and potentially even fewer long-term care placements.
Yeah.
That's a huge win for everyone.
Absolutely.
But we should be clear, while the study's findings are really promising,
Sure.
it doesn't definitely prove that cannabis is directly causing this decline in benzodiazepine use.
Right.
It just highlights the strong connection that definitely needs further investigation.
Yeah, it shows a correlation, but not necessarily causation.
Yeah.
But it's still really compelling data.
Oh, absolutely.
And I think it's important to note that this study didn't only look at benzodiazepines, right? What about other mental health medications?
Yeah, that's right. So they also examined antidepressants, antipsychotics, barbiturates, and sleep medications.
Okay.
However, the results for those drug classes were less clear-cut
Okay.
and sometimes even contradictory.
Oh, really?
Yeah. For example, they found that antidepressant use actually went up after cannabis laws were implemented.
That's really interesting. Why
Yeah.
why would access to cannabis lead to an increase in antidepressant use? I mean, you'd think it'd be the other way around.
It is a bit of a puzzle,
Yeah.
isn't it?
Yeah.
One possible explanation is that people are now more comfortable seeking help for their depression.
Mm.
Perhaps the stigma surrounding cannabis is lessening,
Yeah.
making them more open to kind of addressing their mental health concerns in general.
Okay.
It could also be that with greater access to information, more people are being diagnosed with depression and seeking treatment.
That's a really interesting perspective, yeah. Seems like there's a lot more to uncover when it comes to the relationship between cannabis use and mental health.
Absolutely.
Yeah, more research to be done,
Definitely.
for sure.
This study raises a lot of important questions, and it paves the way for some really exciting new avenues of research.
Yeah, I mean, for example, could increased access to cannabis be leading to earlier diagnosis and treatment of mental health conditions,
Right.
which would explain that initial uptick in medication use.
Exactly.
Hmm, that's definitely something to think about.
Yeah.
What about the other medication classes?
Right. So antipsychotic use also showed an upward trend, but the reasons behind that are even less clear.
Oh, okay.
It could be that cannabis is actually exacerbating psychotic symptoms in some individuals,
Okay.
leading to an increased need for medication, or we could be seeing more cases of what's called cannabis-induced psychosis
Okay.
being diagnosed and treated.
So more research is needed there
Yeah,
to figure that out.
Yeah. As for barbiturates and sleep medications, the study didn't find any strong associations with cannabis laws.
Okay.
So it seems like the most compelling finding here is this reduction in benzodiazepine use, particularly for older adults.
Okay. Yeah, and that makes sense given what we were talking about before. The prevalence of those medications in that population.
Exactly.
So it seems like this study opens a door to some really interesting possibilities,
It does.
especially when it comes to finding safer alternatives to these potentially addictive medications.
Yeah, definitely. But it's important to remember this was just one study.
Right.
While the findings are really fascinating, we need more research to confirm them
Right.
and to get a clearer picture of all the factors involved.
For sure. But it offers a tantalizing glimpse into how changing cannabis policies could be reshaping mental health treatment, particularly for older adults.
Absolutely.
It's really interesting to see how this is all playing out.
It is. It really is.
And it seems like we've only just scratched the surface of what we can learn about cannabis
Yeah.
and its potential impact on our health and well-being.
That's a great point. There's so much more to explore here.
For sure.
For example, have you ever wondered how they conducted this study and ensured they were comparing apples to apples when looking at different states with different cannabis laws?
Now that you mention it, I am curious about the methodology.
Yeah.
It can't be easy to compare states that have legalized cannabis to those that haven't. How did they account for all the other variables that might be influencing medication use?
Well, that's where the synthetic control method comes in.
Okay.
It's a pretty clever statistical technique that allows researchers to create a virtual control group. So think of it as creating like this statistical twin
Okay.
for each state that did legalize cannabis.
Okay.
Instead of comparing states with cannabis laws to states without, they're comparing them to a statistically created twin
Oh, okay.
that represents what might have happened if those laws weren't in place.
That's actually a really helpful way to visualize it.
Yeah,
It sounds like a pretty sophisticated way to control for all those other factors
it is.
that could be influencing medication use.
Yeah, it helps isolate the impact of those laws
Okay.
in medication use.
Gotcha.
Makes the study's findings more reliable.
Yeah, that makes a lot of sense. So I'm starting to understand why this study is considered so groundbreaking.
Yeah.
It's not just about the findings themselves,
Right.
but also about the innovative methods they use to obtain them.
Exactly. And there's another detail I found particularly insightful.
Okay.
The researchers didn't just look at whether a state had cannabis laws in place.
Right.
They also looked at whether dispensaries were actually operating.
Oh, that's a crucial distinction.
It is.
Having a law on the books doesn't necessarily mean people have easy access to cannabis.
Right.
It's the actual availability of dispensaries that matters.
Precisely. It's like having a driver's license.
Yeah.
Doesn't do you much good if you don't have a car to drive.
Yeah, perfect analogy.
Right.
So what did they find out about the impact of dispensary openings?
Well, for example, they found that medical dispensaries were linked to a decrease in the average day's supply
Right.
per benzodiazepine prescription fill.
So not only were fewer people filling benzodiazepine prescriptions,
Right.
but those who were getting them were getting shorter supplies.
Exactly. This suggests that access to medical cannabis might be helping people manage their anxiety and sleep issues
Okay.
with lower doses of benzodiazepines, which could further reduce the risk of addiction
Yeah.
and other side effects. So it's like a
Yeah.
ripple effect of positive outcomes.
Yeah. It's incredible to think about how this one plant can have such a profound impact on our healthcare system.
Yeah.
And remember, we talked earlier about the potential cost savings
Yeah.
associated with reduced benzodiazepine use.
Yeah. And that's a huge factor to consider.
Absolutely.
Those cost savings could be significant, especially when you think about the long-term care costs associated with benzodiazepine addiction and its complications.
Yeah, think about it. Fewer ER visits,
Right.
fewer hospitalizations,
Yeah.
fewer falls,
Mm.
fewer cognitive impairments.
Yeah.
All of those things add up to massive savings
Yeah.
for both individuals and the healthcare system as a whole.
Absolutely. And it highlights the need for more research into the economic implications of cannabis legalization.
Yeah.
We need to quantify those potential cost savings.
Okay.
See how they might vary across different states and populations.
It's like we're piecing together a puzzle,
Yeah,
one study at a time.
it is.
And each new piece of research gives us a clearer picture of cannabis's impact on our society.
It does.
This study challenges so many preconceived notions we've had about cannabis,
For sure.
showing it might actually have a role to play in improving public health,
Yeah.
particularly for older adults.
It certainly seems that way. I think the most important thing the study does is show us that our understanding of cannabis is still evolving. We need to approach this topic with an open mind,
Okay.
guided by scientific evidence and a commitment to harm reduction.
I completely agree. Now, before we wrap up our discussion on this groundbreaking study,
Yeah.
I want to touch on something we mentioned earlier.
Okay.
The potential ethical implications of continuing to prescribe benzodiazepines if cannabis proves to be a safer alternative,
Right.
especially for older adults.
That's a profound question.
Yeah.
It's a complex issue with many facets to consider.
Yeah.
We have a responsibility to protect patients from harm,
Yeah.
prescribe the safest, most effective treatments available,
Sure.
but we also have to acknowledge the limitations of our current knowledge about cannabis
Right.
and the need for more rigorous research
Yeah.
to guide clinical practice.
It's a delicate balancing act.
It is.
We need open and honest conversations about the potential benefits and risks
Absolutely.
of both cannabis and benzodiazepines. We need to be willing to adapt our prescribing practices as new evidence emerges.
I couldn't agree more. This isn't a static issue. It's a dynamic and evolving field.
Yeah,
We need to stay informed and engaged
for sure.
to ensure the best possible outcomes for our patients.
Before we pass the mic back to you, our
Yeah.
listeners, I want to leave you with this thought. What if the stigma surrounding cannabis is preventing us from fully exploring its therapeutic potential? What if it's stopping us from helping people who could benefit from it, especially older adults who are often more vulnerable to the risks of medications like benzodiazepines?
That's an excellent question.
Yeah.
It's something we'll need to continue grappling with as we delve deeper into the world of cannabis and its impact on our health and well-being.
Yeah, it's almost as if we're holding ourselves back from potentially life-changing discoveries
Yeah.
because of these outdated perceptions.
Yeah, and potentially perpetuating the use of medications
Right.
that might be doing more harm than good, particularly in vulnerable populations like
Yeah.
our older listeners.
Yeah, it's a sobering thought, but I also think it's
It is.
a call to action,
Yeah.
We need to break down those stigmas,
Right,
embrace a more evidence-based
for sure.
approach to cannabis, one that prioritizes patient safety, well-being, and informed decision-making.
Couldn't agree more. And that involves
Yeah,
not just researchers and healthcare providers,
right.
but all of us.
Yeah.
We all have a role to play in shaping the future of cannabis
Oh, sure.
and its integration into our society.
So as we wrap up this deep dive, let's take a moment to reflect on what we've learned.
Yeah, it's been a great conversation.
We've explored a groundbreaking study that suggests cannabis might offer a safer alternative to benzodiazepines,
Absolutely.
especially for older adults.
Particularly for older adults, right?
We've delved into the nuances of the study's methodology,
Uh-huh.
the importance of considering factors like dispensary openings,
Yeah,
the potential cost savings associated with reduced benzodiazepine use.
exactly.
We've acknowledged the limitations of this research
Right.
and the need for more studies
Of
to
course.
confirm these findings and address the many unanswered questions.
Absolutely.
But most importantly, we've challenged our preconceived notions about cannabis and recognized the need for a more open
Yeah.
and evidence-based approach
Sure.
to this complex issue.
It's been a fascinating journey, and I hope our listeners found it as thought-provoking as we did.
Absolutely.
We've covered a lot of ground today,
For sure.
but this is just the beginning
Yeah.
of the conversation.
Yeah, this is just the tip of the iceberg, really.
It is.
We encourage you to continue exploring,
Please do.
continue learning, and continue challenging the status quo.
Yes,
Remember, knowledge is power.
absolutely.
The more we understand about cannabis,
Right.
the better equipped we'll be to make informed decisions about its use
Uh-huh.
and its place in our society.
Thank you for joining us on this deep dive.
Yes,
We'll see you next time for another fascinating exploration of the latest scientific discoveries
absolutely.
and their implications for our lives.
Until then, stay curious
Stay
and
informed.
stay informed.
And as always,
Yeah.
keep those brains buzzing.